Hello, class, and welcome to this week's lecture, where I am delighted to welcome you to today's lecture on childhood disorders, with a specific focus on the etiology and developmental pathways of a few of these disorders. Now, because we're kind of taking a developmental psychopathological perspective here, I want to really highlight the reality that we have this intricate interplay between genetics and environmental and neurobiological factors. And all of these contribute to the development of psychological disorders within children. And so understanding these childhood disorders is really crucial for everybody working with children and society at large. It's important for educators, it's important for parents, it's important for caregivers, it's important for clinicians, and really anyone involved in the well-being of children. And so by examining the roots of these disorders and their developmental trajectories, we can really enhance our capacity to support and intervene effectively, ultimately promoting healthier outcomes for children, particularly for those that are facing special challenges. And throughout this lecture, I'll try to keep it evidence-based and cite as much recent research as I have at hand for the peer-reviewed publications relating to childhood disorders. Now, a little bit of what I'd like to talk about today. As always, I want to touch on a little bit of the historical foundations of developmental psychopathology and appreciate some of the early researchers that have paved the way for our contemporary understanding and a little bit of guidance in our contemporary studies. And so by appreciating the roots of our knowledge, we can better contextualize and better interpret our current research findings. Once that's done, we will dive into some normal patterns of development within children. I think it's really important here that we establish a solid foundation for what is normal or expected or typical in the trajectory of childhood development. And so this will serve as a benchmark for identifying any deviations and understanding the nuanced ways in which disorders manifest themselves. We will then move and begin to look at some environmental influences. And by exploring the environmental influences that contribute to the development of childhood disorders, we can better have a sense of what we can do to protect children from negative consequences. So things like family dynamics all the way through to societal influences will be things that we look at and consider how they shape a child's psychological well-being and susceptibility to disorders. And then we'll get to the heart of our discussion with an in-depth exploration of a few prominent childhood psychological disorders, including something known as conduct disorder. And we will dissect here the genetic and neurobiological and environmental factors that contribute to the onset and progression of these disorders, and hopefully shed some light into the holistic influences that play into the development of these disorders. Now, in the realm of developmental psychopathology, one of the pivotal figures who laid the foundation for our understanding of childhood disorders is someone that you may have never heard of, but you should have. We've all heard of Sigmund Freud being the father of psychoanalysis, but his daughter, Anna Freud has done some incredible work in this field. Anna Freud was born in 1895 in Vienna, Austria, and passed away in 1982. Anna Freud was the youngest daughter of that renowned psychoanalyst, Sigmund Freud, and Anna Freud really devoted her life to the study of child psychology and made significant contributions to this field. In fact, a lot of what we think of as psychoanalysis, as far as defense mechanisms and things, are actually Anna Freud's work. And so she doesn't necessarily get the credit that she is due. She established the Hampstead Child Therapy course and the clinic in London, where she has lived most of her life. If you don't know the history there, when the persecution of Jews began during World War II in Austria, the family immigrated to the UK, which is where Sigmund Freud died, and Anna Freud made her life in the UK. And anyways, this center focused on the psychoanalytic treatment of children, and her work was really deeply influenced by her father's psychoanalytic theories, to be clear, but so was most of the world at the time. But she also expanded upon that and adapted those techniques to better address the unique needs of children. And so Anna Freud's key contributions really lie in her pioneering efforts to develop psychoanalytic theories specifically tailored for children. And so she had a ground-breaking work known as The Id and Mechanisms of Defense, where she explored defense mechanisms in children, highlighting their distinct manifestations compared to adults. She also introduced the concept of developmental lines, emphasizing the importance of considering age-related variations in psychological development. And so, with Anna Freud's legacy being so powerful and so enduring in the field of child psychology and psychoanalysis, I think it's important that we recognize all that she has done. And as we move through this course, we will continue to draw upon some of her ideas as we move forward. Now, before we embark on the exploration of the childhood disorders, I think it's imperative that we establish a comprehensive understanding of normal childhood behavior and recognize some typical developmental milestones that provide us a baseline against which we can assess any deviations leading to potential psychopathology. Now, childhood is marked by rapid physical growth and maturation. And this is from infancy to adolescence. And children undergo significant changes here in height and weight and motor skills and sensory abilities. And understanding that normal trajectory of physical development is essential for identifying potential health concerns. And here we can touch upon Jean Piaget's stage of cognitive development, which offers a framework for comprehending how children acquire knowledge, from sensory motor skills to abstract reasoning. And so we'll explore a little bit of the age-appropriate cognitive milestones here. We'll also explore a little bit of Erik Erikson, and Erik Erikson's work on the psychosocial stages really provides some insight into the social and emotional challenges children face in different ages. So a child begins by forming trust versus mistrust, and they form attachments and develop a sense of identity, and they establish autonomy, and all of these things are critical stages that a child will go through for healthy social and emotional development. And of course, there's language acquisition, which is a hallmark of early childhood. And so there's that progression that takes place from babbling through to complex language use. And so emphasizing the role of environmental factors here, I think it's important that we recognize that environment is important in linguistic abilities as well as social interactions. And of course, there is also Lawrence Kohlberg's work on the stages of moral development and how children develop a sense of right and wrong, and how the evolution of moral reasoning is really crucial for comprehending the ethical dimensions of behavior in childhood. Now, the environment in which a child grows and develops plays a pivotal role in shaping their psychological well-being. A healthy and nurturing environment encompasses various elements that contribute to a child's optimal growth. And here are just a few things that we need to kind of be mindful of. The first one is developing a sense of secure attachment. And we've talked about this already a little bit, and this is kind of based upon attachment theory, which was pioneered by John Bowlby, that emphasizes the importance of a secure emotional bond between caregivers and children. So a nurturing environment fosters a secure attachment, providing a foundation for the child to explore the world and develop healthy relationships. Of course, a child needs supportive family dynamics, so a stable and supportive family structure is vital for a child's emotional and psychological development. Positive family interactions, effective communication, and the provision of emotional support really contributes to a nurturing environment. There also needs to be consistency in caregiving. There should be some routines where a child can know what to expect next. They should know that this is coupled with warmth and empathy, and that is being an openness to the feelings of the child and to clear affection for the child, and establishing a secure emotional foundation for the child really is essential for the child to have a sense of emotional stability. It's essential for the development of trust and the formation of a positive self-concept. And so when that consistency in loving caregiving is absent, then you can see all sorts of problems begin to arise. There should also, of course, be stimulating educational opportunities. So an environment that encourages cognitive development includes access to stimulating educational opportunities, and this is not just in the classroom, but age-appropriate books and toys and activities, engaging activities that promote an intellectual curiosity and a problem-solving skills within the child. There should also be healthy peer interactions that contribute to the social development of a child. So opportunities for positive socialization and cooperation and conflict resolution. All of these help to foster essential social skills and emotional regulation. Now, a physically safe and stable living environment is also crucial for a child's well-being. So adequate housing and nutrition and access to health care can contribute to both physical and psychological health. And overall, having positive role models within the family or within the community provides children with examples of pro-social behavior and values. And so observing and interacting with individuals who exhibit positive traits can shape a child's moral and social development. And understanding these components of a healthy childhood environment not only illuminates the factors that contribute to positive development, but also provides a framework for identifying potential risk factors when assessing childhood disorders. Now, there are a few prominent and common childhood psychological disorders that I want to touch on. Now, you obviously can't touch on everything within this lecture, but there are 4 that you will likely come across in working with children. And so I want to kind of dive into each of these and not just look at the symptomatology, but also look a little bit at the complex interplay of genetics and neurobiology and environmental factors, what goes into the etiology of each of these. So let's start off. The first one that we're going to start off with is what's called ADHD, and I'm sure you know what that is. That's attention deficit hyperactivity disorder, and that's characterized by persistent patterns of inattention and hyperactivity and a lot of impulsivity that can significantly impact a child's daily function. And so we'll look at the etiology of ADHD. We'll consider the genetic predisposition and environmental influences that contribute to this. The next disorder I want to touch on is autism spectrum disorder. Now, in terms of these types of disorders, autism spectrum disorder is considered to be what we call a neurodevelopmental condition. It's marked by challenges with a lot of things like social interaction and communication and repetitive behaviors. And so I want us to kind of explore what are the neural underpinnings of this, and what role does environment play in shaping the developmental pathways of autism spectrum disorder. Now, one of the very common ones that you will often see is anxiety disorder. And anxiety disorders in children really encompass a range of conditions. And these include things like generalized anxiety, separation anxiety, all the way to specific phobias. And we'll examine how the neural circuitry and environmental stressors really converge to contribute to the onset of and persistence of anxiety disorders. And one of the final ones that we'll touch on is one that probably most people would think of in terms of social deviance, and that would be conduct disorder. Now, conduct disorder really involves persistent patterns of aggressiveness and antisocial behavior that violates societal norms. And so, within our focus in this lecture, we will try to understand the genetic and neurobiological components that underlie the impulsiveness and the aggressive behaviors here, as well as the environmental influences that contribute to its development. So let's begin by looking a little bit at ADHD, attention deficit hyperactivity disorder, and some of the specific brain areas within this condition. Now, one of the first areas you need to kind of be mindful of with ADHD is the prefrontal cortex. And the prefrontal cortex, remember, is responsible for our executive functioning. And this includes things like impulse control, attention regulation, and decision making. All of these things are implicated in ADHD. And so, one of the first things you need to be mindful of is that there can often be structural and functional differences in this area within a child with ADHD, and so that this is going to contribute to the challenges in cognitive control observed in individuals with ADHD. And we need to be mindful of that. It isn't just that the child isn't working as hard as they can, and it's that there is often legitimately some structural differences that need to be dealt with. And we need to be mindful of that as we work through this. Now, of course, there are some subcortical areas as well that tie in with this. This is the basal ganglia, which is a set of subcortical structures that play a role in motor control, and that's going to be linked to the hyperactivity component of ADHD, because there's often can be dysregulation in this area that contributes to the sense of restlessness, as well as some of the impulsive characteristics of the disorder. There's also what we call the frontostriatal circuitry, and there can be some disruptions in this frontostriatal circuitry that connects the prefrontal cortex to the striatum, so that just the interplay that goes on between these parts of the brain can have some disruption. And so dysfunction in this circuitry can affect the coordination of cognitive processes and motor activity, which can make it more difficult for a child to focus, to work through things on an executive level, on a cognitive level, for planning and that sort of thing. So we need to be mindful that things are just a little more difficult for them. And then underlying all of that, there's the neurochemical components, particularly to do with dopamine, the dopaminergic system, particularly dopamine neurotransmission is implicated in ADHD. So alterations in dopamine levels and receptor functioning contribute to the development of sustaining attention and regulating these impulses. And so some research utilizing neuroimaging techniques such as fMRIs and structural magnetic resonance imaging has provided some valuable insights into the structural and functional differences in these brain areas among individuals with ADHD. And there have been numerous studies published in peer-reviewed journals that have contributed to our understanding of the neural correlates of ADHD. For example, some research, it's not new research, but about 10-15 years ago, really came out and clearly demonstrated the structural differences in the brains of children with ADHD compared to typically developing children, and particularly in the regions associated with attention and impulse control. Now, when we think in terms of what causes, what's the source, the cause, the foundation of attention deficit disorder, there are a lot of different factors that are going to play into this. And so when we look at the environmental etiology of it, we can think in terms of the prenatal and perinatal factors. So within the prenatal area, there can be exposure to certain risk factors such as maternal smoking or alcohol use or exposure to toxins, and that have been linked to an increased risk in ADHD. And so complications also during birth, such as premature delivery or low birth weight, may also contribute to some of these challenges. There can also be adverse experiences in early childhood, including exposure to trauma or neglect or really inconsistent parenting that contribute to the development and persistence of ADHD symptoms. And so the quality of the early caregiving environment plays a crucial role in shaping a child's regulatory capacities. And exposure to environmental toxins, particularly lead, has been associated with increased risk of ADHD, because lead exposure, often from lead-based paints or contaminated water, can have neurodevelopmental effects, impacting attention and cognitive functions. Lead is essentially is deadly to neurons and to the development and sustainment of neurons. And so when lead gets into the system, it can have a profound effect upon a child's brain and brain development. Of course, though, there are some other areas that play into this. Heritability is a huge one. Twin family and adoption studies consistently support a strong genetic component in ADHD. Heritability estimates suggest that genetic factors contribute to, about 70 to 80% of the variance in ADHD risk. And there also seems to be some specific genes related to neurotransmitter systems, particularly those involving the dopamine regulation that have been implicated in ADHD. There seems to be some polymorphism in genes like the DRD4 and DAT1 that seem to have something to do with the development of this disorder. Now, of course, genes in and of themselves are not always determinate. There needs to be an interaction between the genetic vulnerabilities and environmental factors, and so that's been a key part of the research that has been going on. We're looking at people that might be predisposed to ADHD but only exhibit symptoms in the presence of specific environmental stressors, for example, may be part of that as well. So there's a lot of things that can go into ADHD, and we just need to recognize that. Now, as far as the developmental pathways and symptomatology associated with the disorder, I think it's important to kind of recognize some of these developmental pathways. So in early childhood, what should we be looking out for? Well, some of the signs of ADHD become noticeable in early childhood. So things like persistent difficulties in attention or very impulsive activities, a hyperactivity that may be observed in early and preschool ages. These challenges can really interfere with later academic and social and, even familial activities. Now, as the child enters school, these difficulties are obviously going to become more pronounced because there's a requirement to be still, to be self-controlled, to pay attention. And so there's challenges with sustained attention and organization and completing tasks and following instructions that can lead to academic struggles and behavioral issues in the classroom. And ADHD often persists into adolescence and into adulthood. So while hyperactivity may decrease, difficulties with executive functions, time management, and impulse control are going to continue. And individuals with untreated ADHD may experience academic and occupational challenges as well as difficulties in relationships. And so, what are we looking for as far as the symptomatology goes? Well, the obvious ones are inattention, hyperactivity, and impulsivity. So I want to kind of touch on those a little bit. So a child with ADHD often struggles with sustaining attention on tasks. And so they're going to make some careless mistakes, and they're going to have difficulty organizing activities. They may frequently lose items, be easily distracted, and have difficulty following through on instructions or assignments. And then there can be the hyperactivity part. Hyperactivity is characterized by excessive fidgeting, restlessness, and difficulty staying seated. And in younger children, this may manifest as running or climbing in inappropriate situations. Now, in adolescents and adults, they simply might experience internal restlessness. And then there's the impulsivity which involves hasty decision-making without considering the consequences. And children with ADHD may have difficulty waiting their turn, frequently interrupt others, and engage in risky behaviors. And impulsivity can lead to social difficulties and accidents. And there's been some good research in the developmental course of ADHD that emphasizes the continuity of symptoms from childhood into adolescence and adulthood. And some of the longitudinal studies provide some crucial insight into the reality that there is a persistence in ADHD symptoms, but potential adaptations to those symptoms over time. So planning out your life so that you can accommodate for some of these challenges are a good way to move forward into adulthood, recognizing that a lot of this is neurobiologically based. Now, there are clearly some challenges with ADHD that extend beyond simply being diagnosed. And these things are going to affect the child, and they're going to affect the people around the child, the caregivers. ADHD, for example, can significantly impact the child's academic success. There can be challenges with attention and organization and impulse control. And all of this is going to lead to difficulties in completing assignments and following instructions and staying focused in the classroom. And children with ADHD may experience social difficulties due to impulsivity and inattention. And they may struggle to engage in age-appropriate play, have difficulty sharing, and may be perceived as simply disruptive by their peers. And this has the potential of leading to social isolation. There are can be persistent academic and social challenges that can negatively affect the child's overall sense of self, their self-esteem, their emotional well-being. And if these experiences result in frequent setbacks, it can start to create within the child a perception that they are different from their peers and contribute to a feeling of frustration and low self-esteem. But it's not just with the child. There can be some difficulties being the caregiver for someone with ADHD. Caregivers of children with ADHD often experience heightened stress levels. Simply managing the day-to-day challenges associated with the disorder, including homework struggles, behavioral issues, and coordination of care, can be emotionally taxing. Caregivers may find themselves navigating the educational system to advocate for their child's needs, collaborating with teachers and school staff and specialists to ensure appropriate accommodations and appropriate supports within the classroom can be a time-consuming and demanding activity unless the system already has these things in place and do a good job of identifying the child's needs. And of course, the presence of ADHD can impact the overall family dynamics. Siblings will perceive unequal attention or be affected by the disruption caused by a child with ADHD. And so there needs to be a balancing of the needs of all family members while still addressing the challenges of ADHD. And so there's a difficult balance that needs to take place there. The thing to kind of be mindful of is that research has shown that the impact of ADHD upon life is really pervasive. It touches on domains like academic achievement, social interaction, emotional well-being, family dynamics. And so understanding the broad-reaching effects of this really is essential if we're going to adequately tailor interventions that address the comprehensive needs of the child and their caregivers, because everyone needs some care within a situation like that. Now, I want to touch on a few of the strategies for dealing with ADHD and some of the prognosis with this. Now, addressing ADHD, attention deficit hyperactivity disorder, really involves a multimodal approach. So it's a combination of behavioral approaches and educational approaches, and in some cases, pharmacological interventions. So one of the first things that we need to be mindful of is that there should be some behavioral intervention focus on modifying some specific behaviors associated with ADHD. And so we can use some behavior modification techniques, some reinforcement strategies, and some parent training to create an effective way of managing and addressing the impulsivity and the inattention and the hyperactivity that goes on. There should also be some collaboration with educators to implement classroom accommodation and some support services. And that's going to be crucial for academic success. So having support workers within the classroom with individualized education plans goes a long way. So things like providing structure and additional time or alternative assignments that can accommodate the child's needs are significantly important. Some basic counseling and psychoeducation, both for the family and for the individual, can be helpful for the child to help the child manage the emotional aspects of ADHD, and for the caregiver to deal with the stress and coping, and with both of them to foster some emotional well-being and some resilience. And then there's the medication management, and medication normally takes place in the form of stimulants. And that's because there is a lower activity in the prefrontal cortex and in some of the connections between things like the basal ganglia and the prefrontal cortex. And so the stimulants do a few things. They get things moving a little quicker, and they also will encourage the production and release of dopamine. So things like methylphenidate, which is basically amphetamine-based medications, as well as some non-stimulants can be prescribed that cause the symptoms to significantly decrease and improve functioning for a lot of children quite significantly. So medication can enhance attention as well as impulse control in these individuals. Now, there's a few things to be mindful of as far as the prognosis goes. And the prognosis is, what are the outcomes? And so for good prognosis, early intervention and early identification obviously are going to be significant here. When you identify it early, you can intervene early, and that can mitigate the impact of ADHD on things like social development and academic development. And so recognizing that ADHD manifests uniquely in each individual, there needs to be some tailoring interventions to address specific challenges. And the combination of behavioral, educational, and, when appropriate, pharmacological strategies can really yield the best results. And with effective management and support, many individuals with ADHD lead really successful lives and fulfilling lives, and academic and occupational achievements are attainable, and individuals can develop coping mechanisms to navigate challenges associated with these disorders. And ongoing support, including regular monitoring of progress and adjustments to interventions, really ensures sustained success. And so overall, research seems to suggest that the long-term benefits of comprehensive interventions for ADHD can have some positive benefits. And so highlighting the importance here of combining behavioral and pharmacological approaches really do seem to be the best evidence-based practices that for optimizing the outcomes for individuals with ADHD. So that is ADHD. Let's take a little bit of time now and shift gears and look at autism spectrum disorder. And I want to start off by beginning with looking a little bit at the genetic and neurobiological factors that contribute to the development of autism spectrum disorder. First off, we need to be mindful of the reality that there is heritability here. Research consistently shows a strong genetic component to the source, the cause, the foundation of the etiology of autism spectrum disorder. So twin and family studies suggest a higher concordance rate for autism spectrum disorder among identical twins compared to fraternal twins. And so this emphasizes the genetic contribution to the disorder. But autism spectrum disorder is considered polygenic, which means that there are multiple genes that seem to contribute to its development. Now, they've started to focus in on a few of these genes, but the interplay of various gene factors really adds to the complexity of the genetic landscape when it comes to autism spectrum disorder. There can also seems to be some mutations which occur spontaneously and are not inherited from parents that seem to be prevalent in individuals with autism spectrum disorder. And these mutations can disrupt normal neurodevelopmental processes, and these can impact certain brain structures and their function. Now, when we look at the neuroimaging studies, we see that there's some real differences in the structure and connectivity of brains of individuals with autism spectrum disorder. Some atypical regions occur in things like the amygdala, which has to do with emotional processing, the hippocampus, which has to do with memory formation and memory consolidation, and the corpus callosum, which is associated with kind of the integration between the two hemispheres and is associated with social and communication difficulties. And so these subcortical structures seem to have some abnormalities that cause some difficulties in processing within the brain, within communication within different parts of the brain, and with specifically dealing with emotions. There can also be some imbalances in neurotransmitters such as serotonin and GABA, the gamma-aminobutyric acid. And so altered neurochemistry functioning can contribute then to the challenges that we see within social interactions and communication, as well as some of the repetitive behavior that goes on. And there has been some emerging research that I think is quite interesting that suggests that there's an involvement of the immune system, that there are abnormal immune responses and inflammation during prenatal and early postnatal development that may influence brain development and manifest as autism spectrum disorder symptoms, which I think is quite fascinating. Now, back in 2015, there was a paper that was published that I think really significantly advanced our understanding of the genetic and neurobiological underpinnings of autism spectrum disorder. And one of the things that it did was really highlights that interplay between the genetic vulnerabilities and the neurodevelopmental processes that contribute to this whole complex nature of autism spectrum disorder. So the thing that you need to be mindful of with autism spectrum disorder is that it is a spectrum, and there can be a wide variety of differences between the different experiences of children with autism spectrum disorder. Now, one of the hallmarks, though, of autism spectrum disorder is challenges in social interaction and in communication. And children with autism spectrum disorder may struggle with making and maintaining peer relationships. They may struggle with interpreting nonverbal cues and struggle with engaging in reciprocal relationships and conversations. There could also be some repetitive behavior such as hand flapping or insistence on sameness. And that's something that's common with an autism spectrum disorder. And these behaviors really seem to serve as self-soothing mechanisms because there's a strong desire to have kind of an isolation, and so these things will interfere with daily activities and social engagement. And there can also be some sensory sensitivities. A child might have heightened responses to touch or sound or lights or textures, and these sensitivities can lead to discomfort and may affect the child's participation in various environments. And caregivers of children with autism spectrum disorder often face some real emotional and psychological challenges. They struggle with navigating the complexities of things like healthcare and educational systems, and addressing societal misunderstandings about autism spectrum disorder can really add to the stress that we see here. And so caring for a child with autism spectrum disorder can be very expensive. There can be additional therapies, interventions, special education services that are required. And if you're not in a community with these, it takes a lot of energy to advocate for these things to be part of the systems. And there can also be some challenges on the life of the family. Siblings might feel neglected or frustrated because all of the attention is going to the autism spectrum disorder child. And so you need to balance the needs of the child with ASD and other family members that are still going to require careful attention. And all of this needs to be done in order to maintain a supportive family environment and not let it devolve into a very emotionally toxic, reactive kind of environment. And so a lot of the research is pointed to the importance for considering the broader impact of autism spectrum disorder on the family system. Because we need to remember that when there is disruption in one part of a system, it throws the whole system out of balance. And there can be a lot of parts of those systems that will try to force that one imbalance back into place, and that can cause a lot of stress all the way through the system. So we just need to be mindful of all of that. And then, of course, we have autism spectrum disorder. We have some important aspects to deal with as far as treatment goes. As always, early interventions is critical for improving outcomes for individuals with autism spectrum disorder. Specialized programs often initiated during preschool years with focus on things like enhancing communication and social skills and adaptive behaviors are always important. Thankfully, there's some behavioral therapies that are specifically designed for autism spectrum disorder, like applied behavioral analysis, which is a widely used behavioral therapy for individuals with autism spectrum disorder. And applied behavioral analysis focuses on reinforcing positive behaviors and reducing problematic behaviors through some very systematic interventions. And other behavioral therapies, such as social skills training, are also beneficial. And many individuals with autism spectrum disorder experience challenges in things like speech and language development. And speech and language therapy then really aims to improve the communication skills, and including the expressive and receptive language that goes on within social communication. There can also, of course, need to be, over time, occupational therapy that addresses the sensory sensitivities and helps individuals with ASD develop skills for things like daily living, and this includes self-care, fine motor coordination, and sensory regulation. And then there can also be some medications, and oftentimes these medications have to do with some of the anxiety that might come from ASD, sometimes the aggression or attention difficulties that come with ASD. And so when we look at the prognosis for ASD, we can think in terms of individuals with ASD they're really highly individualized because there is such a wide spectrum. One of the key things, though, for having a good outcome is early and intensive intervention. This is not something that you just do on a part-time basis. This is a whole systems approach to ASD that really needs to be put into place in order to help the child to develop in a normal trajectory and a healthy trajectory, and learn to find adaptive functioning that can contribute to an overall higher quality of life. And so transitioning to adult then is going to present some unique challenges for individuals with ASD, because support services should still be in place for things like vocational training and developing individual living skills. And some research here really emphasizes, again, the importance of early intervention in shaping the outcomes, the positive outcomes for individuals with ASD. Of course, there needs a lot more research that needs to be done in this area to refine treatments and ideally to find out the cause and be able to prevent ASD in the future. But that is kind of what we have at this point for ASD, autism spectrum disorder. So the next disorder I'd like to touch on is conduct disorder in children. And conduct disorder is really that serious and challenging mental health condition that really significantly impacts a child's behavior and social interactions. And it falls within the category of disruptive behavior disorders and is characterized by a persistent pattern of violating societal norms and the rights of others. So when we think of conduct disorder, this is diagnosed when a child consistently exhibits a range of behaviors that violate age-appropriate societal norms and rules. And these behaviors can encompass an aggression towards people or animals, destruction of property, deceitfulness or theft, and serious violations of rules. And it's really crucial to note that, the occasional rule breaking or misbehavior is common among childhood. However, in conduct disorder, these behaviors are pervasive and persistent and severe. Now, when we look at the prevalence of conduct disorder, it's essential to recognize its public health impact. That disorder typically emerges in childhood or in adolescence, with symptoms often becoming more apparent during the preteen and early teenage years. And prevalence rates can vary across different populations and cultures, but research consistently indicates that conduct disorder is more common in males than females. And some recent epidemiological studies have estimated the prevalence of conduct disorder to be around 3 to 5% of the general population of children and adolescents. And it's important to approach these prevalence rates with a bit of caution, because there are factors such as age and gender and socioeconomic status and cultural variations can influence the manifestation and the identification of conduct disorder. But what we do know is that it's a complex disorder. And within that, there are some genetic factors that play. Twin adoption family studies suggest that genetic factors contribute to about 40 to 50% of the variance in conduct disorder susceptibility. There are some specific genetic markers and variations in some neurotransmitter systems, such as those in the serotonin and dopamine, that are implicated in the risk of conduct disorder. And these genetic vulnerabilities don't guarantee the development of the disorder. They're just vulnerabilities. And there's also some environmental factors that play into this as well, such as exposure to violence or abuse or neglect or inconsistent parenting. And all of these things can significantly increase the risk of developing developmental disorder, of this conduct disorder. Also, growing up in socioeconomically disadvantaged neighborhoods with limited access to resources and support systems has been associated with an elevated likelihood of exhibiting conduct disorders. There's also some family dynamics, peer relationships, academic experiences that also seem to play a pivotal role here. Disrupted family environments that are characterized by things like conflict, lack of supervision, inconsistent discipline, seem to also be associated with the manifestation of conduct disorder. So you see that there is that typical gene-environment interaction that seems to arise within this complex interplay within conduct disorder. Now, getting back to some of the symptomatology of conduct disorder, it's characterized by a diverse range of disruptive behaviors, often classified into a number of main categories. The first one is aggression to people and animals, so physical aggression toward people and animals, bullying, threatening, or intimidating behavior, initiating physical fights. That's one category. The next category would be destruction of property, so deliberately fire setting with the intention of causing damage, or of vandalism or destruction of other people's property. There's also the movement of deceitfulism, the category of deceitfulism or theft, so frequently lying or cheating or stealing, violating rules in order to gain an advantage, breaking into someone's house or building or car. That would be a category. And then serious violations of rules, so staying out all night without parental supervision, or running away from home, or chronic truancy from school. Those would be examples of a category. And for a diagnosis of conduct disorder, these behaviors need to be persistent and severe and cause significant impairment in social, academic or occupational functioning. Now, according to the DSM-5, it really kind of provides some criteria for conduct disorder. And so to receive a diagnosis, a child must exhibit at least 3 of the aforementioned categories of behavior over the past 12 months, with at least 1 criteria present in the last 6 months. And you can classify it even further here into the subtypes based upon age of onset. So you have childhood onset type, and that's where displaying at least 1 symptom before the age of 10, and generally associated with a more persistent and severe course is what this does. So basically, the earlier that you see this onset of this pervasive pattern, the more negative the consequences are going to be longer term. And so the more important it is to identify some interventions. And interventions for conduct disorder really often involve a multi-systemic approach. There needs to be some behavioral interventions, and this includes teaching parents some effective discipline strategies, teaching them how to communicate develop communication skills, and ways of reinforcing positive behavior, and then also identifying and targeting distorted thinking patterns and promoting problem-solving skills within children. There can also be some family-based interventions, so addressing the systems within the family, so addressing dysfunctional family dynamics, fostering supportive environments, having parent-child interaction therapy that improves the communication between the parent and child is important. Having some school-based interventions, so having a social skills training, helping children to navigate social interactions and peer relationships better, to collaborate with teachers, to establish consistent and positive behavioral expectations, and then on occasion, in some cases, medication might be considered, especially when co-occurring conditions such as ADHD or mood disorders are also present. However, we need to kind of be mindful that medication isn't typically used in conjunction as a primary treatment for conduct disorder. Now, what is the prognosis for childhood conduct disorder? Well, as I mentioned, early onset has worse prognosis. So obviously, early intervention, timely and appropriate interventions, especially during childhood, can significantly improve outcomes and reduce the persistence of the conduct problems. Now, the severity of the disorder, the presence of any co-occurring mental health issues, and the number of symptoms that are exhibited is also going to impact the prognosis, as well as the presence of a supportive family or school or community. What's going to support healthy development is going to improve the outcomes. And also the individual differences within individuals. Some children with conduct disorder show remarkable resilience and respond well to interventions. And so we need to kind of be mindful of all of that as we are thinking of the prognosis, and not simply write off a child because they are having these problems at an early age. The last disorder I want to talk about today is childhood anxiety. Now, we will cover, because anxiety is such a prevalent disorder throughout the lifespan, we will cover it in other places as well and delve into it more deeply in those other lectures. So I just want to touch on it here to acknowledge it and highlight some of the things that we should be looking for. Firstly, it's important to recognize that anxiety disorders in childhood are more than just occasional worries and fears. They are persistent and excessive and significantly impair and interfere with the child's daily life. So identifying the early symptoms of anxiety disorders is really crucial for early intervention and can greatly improve the long-term outcomes. And one of the primary signs is excessive worry that seems disproportionate to the situation. So, for example, a child may exhibit extreme fear of separation from givers or caregivers, or in attending school, or even engaging in routine activities. And this excessive worry can manifest both cognitively and behaviorally, with physical symptoms such as restlessness, upset stomach, muscle tension, sleep disturbances. And another common manifestation is avoidance behavior. Children with anxiety disorders may go to great lengths to avoid situations that trigger their anxiety. And so this can lead to social and academic impairments. And it's not uncommon for them to withdraw from peers, become excessively perfectionistic, or display fear of making mistakes. Physical symptoms can also be indicative here. Complaints like headaches and stomach aches, which don't have any identifiable medical causes, can be expressions of the emotional distress that the child is experiencing. And research consistently shows that untreated anxiety disorders can lead to a range of negative outcomes, including academic underachievement, substance abuse, other mental health issues later in life, particularly more severe development of depression and anxiety later in life. And so it's important to have some effective interventions that combine psychoeducation, cognitive behavioral therapy, and in some cases, medication. And all of this goes a long way to helping the child cope, to understand their anxiety, and to help the child and the family focus on identifying what are the strengths of the child, so that the child can live a positive and safe, peaceful life. And I just want to close with a few definitions from this lecture. So I'd like to identify a few things. ADHD, what does that stand for? That is attention deficit hyperactivity disorder. And what is that? That is a neurodevelopmental disorder that's characterized by persistent patterns of inattention, hyperactivity, and impulsivity that significantly impacts daily functioning. Then there's ASD. What is ASD? That's autism spectrum disorder. And that, too, is a neurodevelopmental disorder characterized by challenging social interaction, communication, and repetitive behaviors with a wide range of severity and presentation. Then there's something known as ABA, and ABA stands for Applied Behavioral Analysis, which is a therapeutic approach that utilizes principles of behaviorism to systematically reinforce positive behaviors and reduce problematic behaviors, and is specifically tailored, usually, to autism spectrum disorder. And as you see, early interventions are specialized programs and services implemented during the early developmental years to address and support the unique needs of individuals with these developmental disorders, things like autism spectrum disorder. And what we consistently see is that early intervention, comprehensive, broad interventions, and interventions that are tailored to the individual go a long ways to improving the life of the individual and the overall functioning of society. Now, I want to close with a question. What is a key component of a healthy childhood environment that contributes to the societal and emotional development of a child. And I will let you think on that one, but a few things that I would like to suggest would be things like secure attachment and positive family dynamics. So, in this lecture, what have we done? We have looked at the life and work of Anna Freud and her insights into childhood disorders. We've looked at things like ADHD, ASD, conduct disorder, and childhood anxiety. All of these things, I'm sure you will see through the course of your professional life. And I hope that you feel that you've gained a little bit of a deeper understanding of the genetic and neurobiological and environmental influences that go into shaping these childhood psychopathological disorders. Hope you enjoyed this lecture, and I will see you next week. You take care. Goodbye.